Imagine you're driving your car and a red warning light comes on in your dashboard. Engine oil temperature. Something is wrong inside the car. You have two choices. You can stop and find out what the warning is telling you. Or you can put a piece of black tape over the light so you do not have to see it. The light disappears. The fault does not. The fault keeps damaging the engine quietly while you keep driving. That is what is being offered to many of you under the names RF treatment, laser therapy, or nerve treatment for knee pain. I am Dr. A.K. Venkatachalam. Today I am going to show you why covering the warning is not the same as fixing what the warning was warning you about. The pain in your knee is not the problem, it is the warning light. And the procedure they are offering you turns the light off, not the fault. Your knee pain is a signal. It is your joint telling you that something biological is wrong inside. Inflammation, bone marrow stress, cartilage breakdown, these are the sources of your pain. The nerves are simply the messengers. Radiofrequency nerve ablation does not treat the inflammation. It does not repair the cartilage. It does not decompress the bone. It silences the messenger. The disease continues uninterrupted beneath the silence. Remember the dashboard light I started with? Putting tape over it does not stop the engine from being damaged. It only stops you from being told that it is happening. Nerve ablation is the same. The pain stops, the damage continues, and without the pain telling you the joint is in trouble, you may use the joint harder, walk longer, climb stairs more, push through what your body was warning you about. So, the disease often progresses faster after the procedure than before, not slower. Faster. This is not a cure. This is a temporary interruption of your body's warning system with the disease left to do its work in silence. The nerve ablation targets the small sensory nerves that supply the knee joint capsule. The procedure burns them. Pain relief follows, sometimes for 6 months, sometimes for 12. But the nerves regenerate. The pain returns. You lost a year of biological window in exchange for temporary silence. Let me share something from my own clinic. A patient came to me last year after being offered this procedure elsewhere. He was skeptical. He understood that pain relief was not the same as joint healing. He asked the right question. Will this stop my arthritis from getting worse? The answer was no. He underwent the PRASAD orthobiologic treatment in November. At his latest follow-up, his knee pain was significantly better. Not because we silenced a nerve, because we treated the biological environment that was generating the pain. A second patient came to me more recently. She had undergone the nerve ablation procedure in February. It worked. Her knee pain was reduced. But she was not satisfied with temporary pain relief. She wanted her joint to actually heal. She asked about stem cell treatment, specifically intravenous and intra-articular delivery. I had to be honest with her. Intravenous stem cell delivery for knee arthritis is not supported by validated clinical evidence. Intra-articular alone has limitations that are well documented. I could not offer her what she was asking for without compromising my clinical integrity. Honest medicine sometimes means telling a patient what you cannot do, not just what they want to hear. So, what should you be asking before you agree to any procedure? Not, how quickly will my pain go? Ask this, will this treatment change the biology of my joint, or will it only change what I feel? Those are not the same question, and the answer changes everything. At MJRC, we do not treat pain signals. We treat the joint environment that is generating them. LPPRP to address synovial inflammation, stromal cells for cartilage support, and paracrine signaling, bone marrow concentrate delivered directly into the subchondral bone where the real structural pain originates. 3 layers, 1 procedure, the PRASAD orthobiologic treatment. If you want to understand the full treatment, I have a dedicated video explaining every step. The link is in the description below. But before any biological treatment can work, your internal environment must be ready. HbA1c, vitamin D, HSCRP, triglycerides. If these are not optimized, even the best biological preparation cannot perform as it should. We check these before we treat. Every patient, every time. If you have been offered nerve ablation for your knee, I am not telling you it has no place in medicine. For patients who are not candidates for biological treatment, temporary pain relief has value. But if your joint still has biological potential, if you are metabolically eligible, then silencing the pain signal is not the answer. Treating what is causing it is. If you would like to know whether you are a candidate for biological joint preservation, leave a comment below or visit our website. The link is in the description. Keep your joints moving and your questions coming.